So hello everyone, this is the model of heart and lung where there is a saddle thrombus which lodges at the pulmonary trunk. So what is saddle thrombus? It is a large blood clot that lodges at bifurcation of pulmonary trunk, which we can see in this model, due to which there is obstruction of blood flow to the right lung and the left lung. Now the pathogenesis part, the clot originates usually at deep vein which runs through inferior vena cava, then to the right atrium and lastly to the pulmonary artery. After which the obstruction of pulmonary artery causes resistance to the blood flow to the right lung and the left lung, which can result into right heart failure. As you can see in this picture, this is saddle embolus which originates from femoral vein, that is of the lower limb, which occludes both left and right pulmonary arteries. This picture also shows the embolus impacted in the pulmonary artery branch, which is derived from the lower extremity. Now the gross part, the clot appears large red tan, which is firm and rubbery, in which it shows alternating layers of fibrin and platelets. There is also distended vessels which appears dark red color, as you can see in this picture. Now the microscopy part, as you can see in this picture, the lines of Zane are clearly visible, which shows alternating layers of platelets and fibrin along with the red areas which contains red blood cells. These lines indicate the thrombus formed in flowing blood. So this thrombus occludes the pulmonary artery. Let's answer some questions. So how common this disease is? So the incidence of occurring this disease is very rare. It is about 2 to 5% of all pulmonary embolism cases. Higher prevalence in patients with immobility and malignancies. Now the symptoms ranges from mild chest pain to severe hemodynamic instability, syncope and sudden cardiac arrest. High mortality without immediate intervention. Now in the diagnosis part, the clinical diagnosis can be done by appearance of tachypnea, tachycardia or syncope or also hypotension in massive pulmonary embolism. There are signs of right heart strain. These are the some clinical symptoms which can diagnose this disease. Also, you can do imaging studies like computed tomography of pulmonary angiography, which is the gold standard method for identification of pulmonary embolism. Now the microscopy part. In short, as I said, the main key point is appearance of lines of Zane, which forms alternating layers of fibrin and platelets along with the red areas which contains red blood cells, and these lines indicate the thrombus formed in the flowing blood. And lastly, the prognosis part in terms of survival rate. So the survival rate, if untreated, mortality is greater than 50%. The thrombolysis or surgery improves survival. So the cure rate is high with early intervention. So these are some prognosis in terms of survival rate and cure. Thank you so much.